Okay, so this video is for new mothers. Yeah, the first time mother, or not even only the first time mother. Yeah, even those ones that have been giving birth for a long time, maybe like up to 2 or 3. Maybe you have not experienced it in the first pregnancy or the second one, then in the third one you eventually had that experience. Okay, so what am I talking about? Talking about jaundice. Yeah, jaundice. Sometimes when people hear about jaundice, they feel like maybe the baby is going to die the next minute. No. Okay, yeah, jaundice, there is one that is very bad and there is the one that is a mild stuff. Yeah, we have two types of jaundice. Okay, we have a pathological jaundice and we have physiological jaundice. Okay, so these two jaundice now, they occur in newborn baby, but the time which they appear will determine which one it is. You know, when I say pathological and physiological, you will be like, so how am I going to know the one that is physiological? How am I going to know the one that is pathological? Yeah, you're going to know the one that is physiological when the jaundice, that's yellow. Okay, what is jaundice now? How do you know what jaundice is? Jaundice is just the yellow coloration of the skin, the mucous membrane, maybe the eyes, the nose, the skin. When you touch it, it becomes yellowish or greenish. Yeah, this can occur in children and it can also occur in adults, but what causes it may differ in each of them. Yeah, in adults it could be kidney problem, liver problem, it could be liver problem, it could be because of shortage of blood. Then in babies it could be the same thing added to the normal one, which is, you know, it is, this jaundice appears due to breakdown of red blood cell. So this will now cause accumulation of those dead red blood cells on the skin. Yeah, it's under the skin, it will just deposit there and start showing that color. And this occurs when the spleen could not be able to absorb it anymore. Yeah, that is when it will occur. Okay, so in babies, this pathological jaundice occurs within 24 hours of birth. Okay, that's if you give birth to a baby now, before the next 24 hours, maybe you gave birth by 6 p.m. Before 6 p.m. tomorrow, you've noticed there is yellowish coloration on that baby's body, or the baby is crying without eating. You see, this is called pathological jaundice. Pathological means that it was caused because of illness, because of disease on the baby's body. And which type of disease can cause this pathological jaundice? It can be caused by a mother who has rhesus negative, that's O negative, or any other blood group that is negative, and this child is having another blood group. So this can occur as pathological jaundice. Then another one is maybe you deliver the baby with infection. You have infection on your body, and or you have malaria untreated, you have shortage of blood, or the baby have already developed shortage of blood. Maybe from the delivery you lost so much blood. Maybe the baby has been losing blood too as well in the body. Maybe you have not been eating well. This could cause pathological jaundice. Okay, and this pathological jaundice, if you fail to treat it, it could bite the baby. In fact, within 24 hours, within the next 2 days, the baby will just give up if you do not take care of that child by treating with antibiotics and other phototherapy, putting under sun, and giving some blood. Maybe if the baby is shorting blood, if you don't give that, the baby can die. But for that of physiological jaundice, that one can disappear on its own. Whether you give anything or you don't, it is going to disappear, because just ordinary breast milk can just take it away. Okay, so this physiological one, it is caused because of the movement of blood in the baby's body while they were in the womb. Is not the same as the one they are facing while they are already born. When they are giving birth to, the blood that has been mixing in the womb will just cease to mix again. Everyone will not be going to different channels. So the ones that has been destroyed already in the body will not just surface as that physiological jaundice. And this jaundice is harmless. It can go off on its own. If you spread the baby on just little sunlight, it will just go off. Make sure you feed the baby with breast milk very well, and this baby will be fine. Okay, so but that of pathological, please don't say that woman had the the baby had jaundice and they gave pawpaw leaf, they gave pawpaw water, they put under the sun, and the baby became okay. For that, you want to do that for your baby. Please don't do that mistake. Ensure that your baby is being taken care of by the doctors or the midwife or the nurses taking care of the child. They need to run a test to check the serum bilirubin. They need to check the level of jaundice that the baby have before they can determine how to manage that baby. You understand? So if the serum bilirubin is too high, then medications need to be given, phototherapy needs to be given. But if it is not too high, they can allow you to go home with the baby. You just keep on breastfeeding the baby, give glucose water, spread under sun, and before you know it, the child is okay. All right? So for this video not to be too long, we have to stop this lecture here and continue in another video. Thank you.